Good afternoon, everyone. We're so happy you can join us today. I'm so thrilled to be here with Dr. Heather Finley. My name is Tamara Bingham. I'm the Director of Business Development at Center for Change, and it's our honor and our pleasure to be with you today and spend a little bit of time and get to hear from Dr. Finley. Before I turn things over to her, we just have a couple of housekeeping things that we need to go over really quickly. So, first, a copy of the PowerPoint is in the handouts section of the toolbar. If you click on that section, you'll see the handout there. It was a very large file. We figured out, we had a couple of folks who emailed saying they couldn't download it. So what you see there is, excuse me, is an updated version that's in a smaller file size. So you should be able to access it if you need to. You can download it. If you are not able to download it from Center for Change, or from this webinar, you can go to centerforchange.com, click on the webinars tab, and you'll see it there. And it's in that one also is in a smaller size, file size, so you should be able to access it on our website. A copy of the post test is also in that same section, in the handout section of the toolbar. This is for reference only. In order to obtain continuing education credit, you must take the post test online. I'll talk about that a little bit more in just a minute. You're welcome to submit questions in the questions section of the toolbar. I'll keep an eye on those throughout Dr. Finley's presentation, and then we'll come back at the end of her presentation and we'll try to get to a few questions at the end. So feel free to type those in. We just have way too many folks on in order to be able to have your cameras and mics on and ask questions live. So if you will just submit them in the questions section and type those in, we'll get to as many as we can at the end. When the webinar ends, there'll be an evaluation that will pop up on your screen. If you'd be so kind as to take 30 seconds or so to fill out that evaluation. That's a continuing education requirement for us. It's completely anonymous, so feel free to be candid in your feedback. We tabulate those results and then send those to the CE approval entities as a final step in their process. And then about an hour after the webinar ends, you'll receive a separate email from GoToWebinar with the link to take the online test. The email will look similar to the one you received when you first registered for the webinar. So it will come from GoToWebinar. There'll be a link there. You click on the link, that'll take you to Class Marker where you'll take the test. Once you pass the online test, your CE certificate will automatically be downloaded to your computer. So check your downloads file if you don't see it on your screen. Okay, I'm excited to turn things over to Dr. Heather Finley. Dr. Finley's a registered dietitian. She's a gut health specialist, an eating disorder specialist. She's a well sought out presenter. She's also my friend, and I've known Heather for many years, and she's an incredible human and person, as well as a phenomenal dietitian and gut health expert. Before I turn it over to her, I'm just going to give a quick caveat that Dr. Finley lives in Texas, and it's really hot there, and they're having some rolling blackouts. And so fingers crossed that they don't have that happen in the next hour and 10 minutes or so. If it does, just bear with us. I'll pop back on. That means we'll lose Heather. She'll go away suddenly, and I'll pop back on and say it looks like we've lost Heather for a few minutes. She'll call in, and I'll load the slides in, and we've got a plan, folks. We'll figure out a way to make it work, but please feel free to give us good thoughts and wishes that we don't have to do that. So just in case that happens, I wanted to give you all a heads up. So without further ado, I'm going to turn it over to Dr. Finley. And Heather, I'm going to send this over to you. It should be coming your way.
All right. Can you hear me and see me?
I can hear you and see you, and I just need you to start your, yep.
All right.
As soon as it's up and running. Okay, you're up and running. I'm gonna turn off my mic and my camera, but if you need me, I'm right here, just holler. Otherwise, I'll see you at the end.
Okay, great. Well, thank you all for being here. Like Tamara mentioned, it is hot in Texas. I think yesterday it was like 106 degrees. So if you live in Texas, I feel you. But just praying that there's no rolling blackouts. But like she said, if there are, we will figure it out. So we will roll with the punches. But thank you, Tamara and Center for Change, for having me. It's an honor to be back this year. Last year, if you missed it, we did a 4-part series on the gut brain. And really, these presentations were developed out of the feedback from you all the questions that you had. So I really hope that this is valuable to you. If you haven't seen the part 2 and part 3, we will be having those in August and September, but we are just going to get rolling. So there's nothing more frustrating if you are a clinician when you're working with a client with an eating disorder and you just can't seem to help them. You are stuck because they're bloated and they are complaining of constipation. Maybe they're complaining of acid reflux. Maybe they're just flat out uncomfortable and they're starting to lose faith in the process. I think I've seen stats anywhere, they're kind of all over the map, but some of the stats say that up to 90% of individuals with an eating disorder experience some type of digestive discomfort, which is a lot. So more than likely, if you're a clinician and you are here attending this webinar, you have probably worked with clients that have these issues. So they're telling you they're bloated, they're telling you they're constipated, and as the eating disorder clinician that you are, you might be challenging them to push past this discomfort. It's going to get better. It's going to get better when you start eating and your gut turns back on. It's going to get better. But what if the symptoms were actually coming from the gut as well? I want to tell you a story. I will never forget this one day. I had this client come to my office. She plunked herself down on my gray couch in my office and she just started crying. And she said, Heather, I don't think I can do this anymore. I am so uncomfortable and I want to eat the meal plan that you've given me and I want to do all the things that have been recommended to me, but I'm so uncomfortable. I'm bloated. I haven't had a bowel movement in 7 days. I'm nauseous and I really just don't think I can do this anymore. And in that moment, I was a little bit perplexed. I'm like, okay, well, I've been in her shoes before, not having a bowel movement for 7 days, and that would be miserable. And so just a little more background on this woman. She had been in an eating disorder treatment center. She had been on a meal plan to gain weight, and she's crying because she's so uncomfortable. And she's like, I just think there's something else. And I really don't think that it's my eating disorder talking. I really do think that there's something else. So she was going to the bathroom once per week. She felt what she described as not being 9 months pregnant by the end of the day. She was burping constantly. She was miserable. And so in that moment, I was like, okay, we're going to figure this out because I'm not giving up on you and you're not giving up on yourself. So under further investigation, this client actually had SIBO. If you're not familiar with SIBO, SIBO is small intestinal bacterial overgrowth. It happens when there is an overgrowth of unwanted bacteria in the small intestine. And it can lead to a lot of symptoms like constipation, bloating, gas, burping, nausea. And this SIBO that she had was actually impacting her ability to absorb nutrients. You absorb the primary bulk of your nutrients in the small intestine. So not only was she uncomfortable because of these symptoms she was having, she also really wasn't getting the benefit of the food that she was eating on this meal plan because of this SIBO. So as we worked together to address her SIBO, her constipation improved, her bloating improved, she was actually able to eat more, her anemia improved, her B12 deficiency improved, and she was a lot more comfortable and she was a lot more compliant with what I was recommending. So in that moment, the lesson that I learned was I checked my instinct really to write off these GI symptoms as an eating disorder and partnered with her on this journey to really dive into what was going on. I think so often our intuition or instinct is to just write it off, like I was saying earlier, like just push past it. your gut's going to turn back on, you're going to feel better. And that might be the case. I'm not saying that that's not that everyone has SIBO or anything like that, but when your client has an instinct and you have an instinct, or a gut instinct is present, it is important as a clinician to really look into those things to make sure that you can really help your client on that journey. So I really wish that this story was a single incident, but it's not. This is really why I started digging into the gut and started looking at the gut-brain connection and digestive health and eating disorders, because it kept coming up so often. And I imagine that you might be here today for the same reason. So I really hope that today is valuable to you as we go through some of these symptoms together, and really when you need to look beyond the eating disorder into more of the digestive piece, and how you can combine them together so that you can help your client get better results. So a little bit about me. Like Tamara mentioned, my name is Dr. Heather Finley. I'm a registered dietitian. I run an online practice for gut health, but we do see a lot of clients with past disordered eating or an eating disorder. And I struggled with my own digestive issues for 20 plus years. And I really started specializing in digestive health, one, because of my own issues, but two, because I wanted to be able to help my clients better. So I'm glad to be here with you today and to share this space in your AirPods or in your lunch hour, or whatever you're doing for an hour. So the plan for today, first, we're going to look at when to look beyond the eating disorder, when it's important to look maybe into the digestive piece. And then we are going to look at the common symptoms and causes of those symptoms. Obviously, this could go on forever, so I've narrowed it down to just a couple of the common symptoms to give you some really actionable things that you can take home to your clients today. And then lastly, like I said, we're going to learn how to actually address these things so that if you have a client this afternoon, you can use all of this. So I think sometimes with digestive issues, it can feel like throwing darts at a wall and trying to figure out, okay, what's going on? Do you need a probiotic? Do you need a prebiotic? I've heard a lot about symbiotics. Do you have SIBO? And sometimes I feel like this just throwing random darts to see if something sticks. And that can be a hard place as a clinician, because you want to be able to help your client and you want to help them get to the solution quick so that they can feel better. So I want to just play the scenario a little bit with you. Let's say your client presents with GI symptoms. Maybe your first attempt is to refeed them. You want to get them eating enough calories. You want their gut to turn back on, but it can kind of feel like trying to find a light switch in the dark in a house that you're unfamiliar with. You're just searching the walls, trying to feel out where that light switch is. But the client just continues to get more bloated, more constipated, more frustrated really with the situation. So knowing when to intervene in the digestive piece can really be an important piece of the puzzle. Obviously, there's tons of research that still needs to be done on digestive health, eating disorders, mental health, but every day we're learning more and more about the gut and its impact on the brain and its really impact on the body overall. So I really do think that this digestive piece is super, super important. So let's talk about some common symptoms. Some common symptoms with your patients most likely would be constipation, maybe like the client I just described, going to the bathroom once a week, feeling really uncomfortable. Bloating, usually a result of constipation, can be very uncomfortable. And I want to just differentiate here the difference between normal bloating and not normal bloating. So bloating is normal. Bloating can be a normal part of the refeeding process. It can be a normal part of just an everyday person eating something. When someone eats a large quantity of fiber, let's say someone eats a large plate of Brussels sprouts or broccoli and they're super bloated after, that's normal. If someone is chronically bloated after every single thing that they eat, it's getting progressively worse throughout the day, maybe they're even waking up bloated, that would be what I would classify as common, not normal. Probably very common for your eating disorder clients, but not normal. So there are things that we can do to improve this, but usually the number one cause of bloating, at least in your clients, is most likely going to be along the lines of constipation, potentially an imbalance of bacteria, which we'll talk about, even maybe stomach acid issues, or just digestive insufficiencies, and we'll talk about all of that. Diarrhea is another common symptom. I'm going to talk a little bit about how to know if it's actually constipation that's causing the diarrhea, but especially with a stress response, diarrhea is very common. You may have a client that goes to the bathroom every third day. It's probably more actually constipation, but we'll get to that. Next up is gas. Gas can be very uncomfortable, but it also can be extremely embarrassing. And if your client has gas, they most likely are going to want help with that. Some common causes would be constipation. If someone hasn't had a bowel movement, they're most likely going to have gas. Bloating obviously can be a cause of that as well. Food intolerances, we'll talk about that. Acid reflux, we won't have time today to talk in depth about acid reflux, but I will talk briefly about it. Acid reflux is very common in the refeeding process because of stomach acid issues, because of constipation, because of slow gastric emptying and delayed motility. Cramping, another common symptom. You might have a client that's doubled over in pain after they eat. It can be extremely uncomfortable, and it can be really hard for them to want to continue to eat if they get cramping after they eat. So all of these things, very important to pay attention to, and also to be able to differentiate what's normal and what's not normal. All right, so how do we actually help our clients? I think the digestive health world in general is portrayed as what you shouldn't eat. I'm sure we all follow people maybe on YouTube, Instagram, whatever it is, social media, and you've probably been frustrated by their message about, their gut health detox or their gut health diet or trends or supplements, fads, whatever it is. But I want to propose here that digestive health is really more about abundance than it is about restriction, because the largest study that we have on the gut shows that the wider variety of bacteria that you have in your gut, the more diversity of the wider variety of food that you eat, the more diversity of bacteria that you have in your gut. So I think for many years, we've gotten digestive health all wrong. I think people hear gut health and they think, what do I need to cut out in order to feel better? And there may be certain instances where someone may have to cut something out, but I would say more than likely, especially with the clients that you may see in your practice, it actually is more about what they need to include and what they need to add to their diet to improve their symptoms. The gut is a very diverse ecosystem. It's like a rainforest of bacteria, fungus, archaea, and lots of other living organisms. And all of these need food to flourish. Next up is addressing gut imbalances. I'm going to show you some research in a little bit about specifically eating disorders and the gut and the diversity of bacteria in the gut. But when someone has starved gut bacteria, they may have an imbalance of bacteria, and it's very important to address that. Oops. And then lastly, the nervous system. For many clients that we work with, this is often a very missing piece. When the nervous system is on high alert all the time, especially in the society that we live in, where stress is just kind of a common thing, the nervous system is perceiving food as a stress multiple times a day. Every time your client sits down to eat, they are having a stress response. And so when a client is in a state of stress, their salivation decreases, the gut slows down, the blood flow goes to the muscles and away from the gut, and overall digestive function decreases. So it is important to mention the nervous system piece, because without the nervous system piece, you might get stuck. There's only so much that we can do on the nutrition side of things, maybe supplement side of things, mindset side of things, if the nervous system continues to be in a state of stress. And this is probably the one of the things that you might get maybe even the most resistance from with your clients, because nobody really wants to address their stress or the nervous system component, but it can be very, very important. So I want to talk about the overlap of some of these common symptoms that we see in digestive health and eating disorders. So the ones that I want to hone in on are constipation, bloating, and then diarrhea. The quote unquote root cause of a lot of these things is very similar, but the way in which it presents can be very different. So the client that I was describing earlier that had SIBO, she had severe constipation. Someone else could have SIBO or many of these other things listed here and have diarrhea. There's a lot of things that are going to affect this, genetics being one of them. Obviously, the makeup of the gut microbiota, which kind of stems back even from birth. So there's a lot of things that can contribute to this, but we want to hone in on the causes of it, because if we know the cause, then it's a lot easier to treat these things. So this is not necessarily a one size fits all, but in general, this is kind of how it's going to look. With constipation, diarrhea, and bloating, dysbiosis, poor gut motility, stress, overexercise, too much, too little fiber, and then dehydration really can cause all three of these things. And then just to kind of distinguish, typically, not always, with constipation, I would throw undereating in that category. Again, someone could definitely have diarrhea if they're undereating, especially if it's a stress response to food. You can also have diarrhea from constipation, and I see the most diarrhea in this population caused by sugar alcohols, caused by a lot of the diet products that these clients may or may not consume. Then on the bloating side of things, constipation, again, going to be probably the leading cause of bloat. Low stomach acid, definitely going to lead to a lot of that post-meal bloating. If you've come to some of the past webinars, I talked a bit more about stomach acid, so we're not going to talk too much about that today. And then too much fiber. So I think clients tend to be on either spectrum, where they're either eating way too much fiber or they're eating no fiber, maybe because they're not eating any carbohydrates. I think it can kind of be either way, depending on the food rules that the client might have, the different trigger foods that the client might have as well. So just to dig into these things a little bit more, dysbiosis, just to define the term, is an imbalance of bacteria. And you can have dysbiosis in the gut, you can have dysbiosis in the vagina, you can have dysbiosis anywhere that has bacteria. So this could be from too much bad bacteria, or it could be from too little good bacteria. And I'll show you some studies in a second that might kind of make this come a little bit more full circle for you. Poor gut motility. This has to do with the contraction of the gut muscle. So just like any other muscle in our body, our gut has to contract to move food and waste through so that the client or you can have a bowel movement. In a state of starvation, a state of stress, it lacks energy. So just like if you weren't eating and you might not be able to hit a PR on a chest press, your body is not prioritizing fuel for the gut as it would your heart, your lungs, your brain in a condition of or a situation of undereating. Stress, probably the number one root cause of anything we're talking about here, any perceived stress. So this could be a food stress, this could be stress from under eating, this could be stress from over exercising, trauma, nutrient deficiencies, even an underlying infection, SIBO, stress from work, relationships, the list could go on. The gut is more worried about the perceived stress than it is about digestion. So stress will always continue to disrupt digestion if left unaddressed. Too much or too little fiber, I mentioned briefly, your client might be on both ends of this spectrum, but eating 0 carbs equals eating pretty much 0 fiber. We need fiber to feed our gut bacteria. And then the clients who only eat fiber. So they could definitely be bloated from way too much as well. And then dehydration. You may also have clients on both ends of this spectrum. This is a stress on the body if your client is super dehydrated. Your minerals are going to be imbalanced. You need to drink fluids, obviously, for a lot of different reasons in the body, or you may even have mineral imbalances or electrolyte imbalances from too much fluid. So there's definitely a Goldilocks mentality here. So I want to dig into some of the research. There's lots of studies mentioned on the last slide. If you want to look these studies up, I'm just going to talk about a couple. But as I mentioned earlier, there's still tons of research to be done, but it's cool to see all of these research studies coming out. So this first study that was done is looking at the relationship between the gut microbiota, so the population of gut bacteria, and anorexia nervosa. And what they found was that the lack of diversity, so the lack of abundance of bacteria in the gut, is going to affect the pathophysiology of anorexia. So in this study specifically, they're talking about butyrate, which is a short-chain fatty acid. Short-chain fatty acids are produced as a byproduct of fermentation in the gut. So when your client eats a prebiotic fiber-rich food, it feeds the probiotic bacteria in the gut, and as a result of this fermentation, it produces short-chain fatty acids. And these short-chain fatty acids are anti-inflammatory to the body, to the gut, to the brain. And so what they're talking about in this study is the correlation between the gut brain and how the lack of diversity and the lack of short-chain fatty acid production is then affecting this gut-brain connection, and it's becoming a super vicious cycle. So very, very interesting study. It makes sense, right? If your client is eating very little food, then of course the diversity and the abundance of bacteria in their gut is going to diminish and decrease. So this next study is looking at patients with generalized anxiety or an eating disorder. And what they're saying here is that they're showing a specific profile of gut microbiota, and this imbalance could be impacted by a multi-strain probiotic. There's obviously there's a lot of limitations to this because there's limitations to taking probiotics, their survivability, etc. So I want to back up to the previous study. You could bomb your client all day long with probiotics, but if their diet does not support the fueling of these probiotics, then we're still running into the same problem. So probiotics might be a temporary, really helpful solution, but we need to look at it holistically because at the end of the day, those probiotics need fuel and they need food. All right, so another study here is showing the butyrate producing species. So there's specific types of bacteria in the gut that produce butyrate, the short chain fatty acid I was speaking about earlier, and how those with anorexia have a decrease in the butyrate producing species of bacteria and an increase in the mucin degrading species. So the mucus lining of the gut that really kind of acts like a jelly layer that protects the gut, from causing an immune response to anything that could cross it. I'm sure you all have seen the term leaky gut going around on the internet. Leaky gut is the trendy term for what is actually called intestinal permeability. So intestinal permeability happens when the gut lining, it looks like little teeth. When the gut lining comes apart, this is when the gut becomes leaky. The little teeth come apart, food particles, bacteria, whatever, get through, the immune system causes a response, and so the goal is that we want to glue the gut back together so it's not as permeable, and we want to increase the mucus protection layer in the gut. The other interesting piece about this study, and I think this is actually a question on the quiz, is there's a specific type of bacteria, Methanobrevibacteria smithii. This bacteria was higher in clients or patients or subjects with anorexia nervosa. This specific type of bacteria slows gut motility. It impacts the small intestine. It's what causes that methane gas production. And it's, again, small intestine is where nutrients are absorbed. So this is a really interesting finding, because if these clients have an overgrowth of that type of bacteria, no wonder they're constipated, they're bloated, they're uncomfortable, they might be at a higher risk of SIBO, etc. So just to kind of sum it up a little bit, there is a really important component here of the gut in clients specifically with anorexia. There's lots of other studies on binge eating that you can look up, but I want to just kind of take this point home. Prebiotics feed probiotics, produce short-chain fatty acids. Short-chain fatty acids help the gut-brain connection, so they are important for anxiety and mood, and they also are helpful to improve that mucus layer in the gut. And those clients that you might be seeing, constipation, bloating, even diarrhea, could have this overgrowth of unwanted bacteria, such as Methanobrevibacteria, which could be causing some of the symptoms that they're having. So there's lots of other studies we can look at. We need more research, obviously. These are just a few studies that you can take a look at after, but very, very interesting. So here's kind of the process that can happen. So we have alterations in diversity in the gut. That's going to disrupt the gut barrier. Again, that gut lining has a mucus layer above it. It's only one cell thick, your gut lining, so it's very easy to come apart. This overall is going to increase inflammation in the gut. It's going to increase inflammation in the body. It's going to cause all sorts of issues that you don't want your client to have. This is going to dysregulate appetite. It's going to increase constipation, potentially increase diarrhea depending on which bacteria is overgrowing, increase bloating. Then this leads to a decrease in short-chain fatty acid production, leads to lots of comorbidities, mood, the gut-brain axis, and the cycle just continues to repeat. And it can be sometimes hard to figure out, where do we intervene? What do we do? What's causing what? What's the eating disorder? What's not? What's the gut? So I want to dig into some of that. So we want to foster healthy amounts of bacteria and promote diversity in the gut. That's the overall goal, because we want to improve short-chain fatty acid production, proper mucus production, and then overall bacterial diversity. So there's a little bit of a process here and the order of events. So first, we want to address bowel consistency in gut motility, and I'm going to show you how to do that. Second, we want to focus on nutritional rehabilitation. These can be reversed depending on the state of your client. Obviously, if they are on a tube feeding or if they are severely malnourished, that's going to go first or together. You can really do these together, actually. And then lastly, we want to utilize any additional testing or interventions, but we are going to really hone in on the first two pieces of that today. So first, constipation. The unwanted symptom, actually, I would probably say bloating is the unwanted symptom. So there's a couple questions that I want you to ask your client. Number one is, how often are you going to the bathroom? They should be going to the bathroom every day. If they're not eating enough calories, they're not going to be going to the bathroom every day. But if they are, they should be going to the bathroom every single day. The other question that you want to ask is, how easy is it to pass stool? How easy is it for you to have a bowel movement? Are you straining? Is it coming out of you very urgently? Are you sitting there for hours? I've definitely had my fair share of clients who they have a whole routine. They have to drink coffee, they have to sit on the toilet, they have to breathe, and 45 minutes later, they may or may not pass a small pebble. That is really challenging because not only is it time consuming, it's very frustrating. So you can definitely help your clients with that. So if your client is passing hard pebbles, it's easy to assume that they're probably dehydrated. The first step for constipation is ensuring adequate hydration. You cannot really do anything with the diet as far as like fiber intake or prebiotic intake if they're not drinking enough water. And I know that this might even seem like a huge hurdle for a lot of clients because they might be resistant to actually doing this, but ideally 80 to 100 ounces. Obviously, this is like very generalized because I don't know your specific client. We find that most of our clients need added electrolytes and added minerals. I've talked about this in the previous webinars, but some of the common ones that we use, Ultima is a common one, Element, which is much higher in sodium. You can use trace minerals, but in general, they need electrolytes to basically help their cells absorb water. I actually posted something on Instagram yesterday about how minerals and electrolytes help your cells to go from raisins to grapes. They help the cells to be plump and full and nourished. So first step for constipation, ensure adequate hydration, 80 to 100 ounces of water a day. Next, you might need to use some magnesium to loosen the bowels. I know I'll probably get the question, what about Miralax? What about all these other things? Most likely your client has probably tried Miralax and is still not having a bowel movement. That's another topic for probably another day. We like to use magnesium because it's naturally going to loosen the bowels and help the stool to be more soft. So there's many different forms of magnesium. I like using magnesium glycinate because it crosses the blood-brain barrier. It's going to help with anxiety reduction, stress reduction. You can also use citrate if they really need some help in the constipation department. We usually have them start at 200 milligrams at night before bed in either a capsule or a powder. There's lots of different brands, and you can increase it by 100 milligrams. There's lots of conflicting opinions on the max dose of magnesium. In general, if my client is getting up to like 600 milligrams of magnesium, I'm looking at, okay, what other minerals are off that they're not absorbing the magnesium? If they are taking super high amounts of magnesium and it's not doing anything, I'm thinking sodium. They need sodium to help with magnesium absorption. So that's just something to keep in mind. Next up, with constipation, ginger tea. Drinking ginger tea, which the milligram equivalent, if you were going to use a capsule, is 1,100 to 1,500 milligrams. There's a brand called Traditional Medicinals. They have ginger tea. It's this exact dose. You can have them drink it in between meals. It will naturally help stimulate that gut motility. So get that muscle to start contracting to move things through. You'll be surprised how well this works for clients and how much better they feel. Ginger also really helps with just digestion overall. So a lot of your clients will probably really like this. If they struggle with bloating, if they struggle with any type of gas, they probably will really enjoy drinking this. You can drink it hot, you can drink it cold, either way, it can really, really help. And then the last piece for constipation is we want to activate the vagus nerve. The vagus nerve connects the gut and the brain together, and when the vagus nerve is aggravated or stimulated, it will cause the stomach to produce acid. It will cause digestive enzymes to be secreted. It will help with gut motility, and it will help with constipation because it's getting the client's nervous system into a state of rest and digest. So one thing you can have your client do is either hum, you can have them gargle, you can have them sing. One thing that we like to have our clients do is we have them hum happy birthday twice before they eat a meal. It can be super effective, and it kind of goes along with like the whole concept of habit stacking. So attaching a habit that they already do, so eating a meal, to something that they don't already do, so that they're more likely to remember to do it and remember to be consistent with it. Okay, next up is gas and bloating. Gas and bloating is very uncomfortable. As I mentioned earlier, the number one cause of bloating is going to be constipation. If your client is constipated, it's going to be very hard to resolve their bloating. You have to get the bowels moving before you're going to see really any improvement in the bloating and just overall digestion. It's usually the last thing to resolve. So the first step is to rule out constipation and resolve it. So go back a couple steps and work on resolving the constipation. And over time, you'll notice maybe the bloat doesn't go away overnight. Nothing ever does, but it slowly starts to get better. Next up, you can use digestive bitters. This is just an example of a brand that we use. There's lots of different brands. They do not taste good. They're bitter. That's exactly the point of what they do. If you've ever tried them, they're not tasty unless you really enjoy bitter foods. They contain phenol, which is really helpful for gas relief. They contain other bitter herbs that help to stimulate digestive juices. If you've attended the previous webinars, you've heard me talk about the concept of meal hygiene. So chewing, the whole process of really the eating experience before it actually happens. So the salivation, the smelling, getting the body into rest and digest, again, super helpful for acid reflux if your client struggles with that. But bitters are actually going to promote salivation because of their bitter taste, which is why you can't take bitters in like a capsule form. It's not going to do anything. You need to taste the bitters to salivate, to then turn the stomach acid production on, turn digestive juices on, and get everything going. If they have consistently smelly gas, if your client is like, I have very smelly gas after every single time I eat, or every time I eat certain foods, it might be helpful to assess for food intolerances, such as lactose intolerance. It's very common for someone to be lactose intolerant. And if they know that they're lactose intolerant, they might be able to just substitute lactose-free dairy products for the regular ones, and they can still enjoy the dairy food without the lactose in it, and that could definitely help their symptoms. You could also look at carbohydrate malabsorption. So then we're kind of getting into more of like the SIBO spectrum. The other thing that you might want to just note or think about, if your client has consistently sulfur smelling gas, I would definitely want to rule out hydrogen sulfide SIBO. There's 3 types of SIBO, hydrogen sulfide being one of them, and one of the common symptoms that comes along with it is sulfur smelling gas. You can use lots of different tests to test for SIBO, but there's only one test that tests for hydrogen sulfide. It's called the Trio Smart test. They have a website, you can look it up. But if they have consistently smelly gas, it doesn't make sense to just test for methane and hydrogen dominant SIBO because you're missing a big piece of what could be going on. And then just as kind of a reiteration here, typically bloating is going to be the last symptom to resolve, unfortunately. So I think if you can communicate that to your client, they at least are going to be aware of the process. They may not like it very much, but they might know that as the constipation improves, as their gut motility improves, that the bloating will get better. All right, now for diarrhea. So the first step is to rule out overflow diarrhea. I mentioned earlier that the diarrhea could actually be caused by constipation. So the way in which you would know this is if your client says, I go 3 days without having a bowel movement, and then I have really urgent diarrhea and it's a lot. That is the most severe form of constipation. So they may think they have diarrhea, but they really have constipation. So every 3 days, every 4 days, lots of diarrhea, that's constipation. If they're consistently having diarrhea every single day, that is a different situation. So if it's every day, I definitely want to look at their stress response. If it's after a meal, if they're eating a meal and they're running to the bathroom, there's something called the gastrocolic reflex. This in some cases can be somewhat normal. Basically, the digestive system senses that food is coming and it's making room for more food. So what you can do here to decrease this urgency or to decrease this uncomfortable sensation after a meal is work on the stress response before a meal. So the vagus nerve stimulation, decreasing the stress response, even digestive bitters can be really helpful here, and making sure that their bowels are moving every single day. You may even have them try to go to the bathroom before they eat, but in general, that's not necessarily a bad thing unless it's affecting their quality of life, or if it's super urgent where maybe they're running to the bathroom. You definitely want to look at the stress response that could be going on. The other thing that we see often is urgency as a result of pelvic floor issues. This is one of the things that I think is missed a lot, is the pelvic floor piece. You can have your client go get assessed by a pelvic floor PT. It can be super, super helpful. Usually in a couple sessions, they'll feel extremely better. The other piece could be food intolerances again, or again, the stress response related to a situation. So maybe they only have diarrhea every time they think about going to the grocery store, or maybe they only have diarrhea when they leave the house. So definitely there's a nervous system component piece here, working on like rewiring that mindset, rewiring the situation to help them not have stress around that experience. So the quickest way to change the gut is through diet, not supplements. I think, like I mentioned earlier, a lot of times people think gut health is like the super trendy, like juice cleanse or detox or whatever. But the best way to change the gut is through the diet. And so there's a couple things that we really, really want to focus on here as far as the gut is concerned. We want to focus on prebiotic fiber. So as a quick little tip, all prebiotic fiber is fiber, but not all fiber is prebiotic. So the type of fiber that tends to be prebiotic is soluble fiber. These are typically the types of fibers that your client is going to want to avoid because they're going to cause the most symptoms, because what they're doing is they're feeding the probiotic bacteria and they're causing that fermentation. So they're causing a little bit of gas production, that normal gas production. Prebiotics being found in things like onions, leeks, garlics, oats, bananas. There's lots of foods that have prebiotic fiber. The other thing we want to think about is polyphenols. Polyphenols are a plant compound that are not a prebiotic fiber, but they do act like a prebiotic fiber. So any like dark red cherry, cranberries, even like green tea is a polyphenol. And then lastly, probably the easiest to tolerate is resistant starch. Resistant starch, again, acts like a prebiotic, but is not a prebiotic, can be a lot easier to tolerate. So cooked and cooled starches. So oats that you have cooked, cooled, even if you reheat them, they still retain the resistant starch properties. Green bananas are another source. Your client's probably not going to want to just go eat a green banana, but they are a form of resistant starch. You see them in a lot of these functional foods that are coming out, added to the food to promote that resistant starch. So we're thinking here about how to increase diversity on the plate, which I'm sure you are already doing, but there's ways to just be a bit more strategic here. So encouraging diversity of the prebiotic fibers, of the polyphenols, of the resistant starches to help promote diversity in the gut and that short chain fatty acid production that we are looking for. And low and slow is the motto here. We're not trying to overhaul the gut in one day. This might look like increasing diversity by 1 food a week or 1 food a month even. The more you can make your client buy into this and get their buy-in on it, they're going to be more compliant with it, obviously. And if you go too quick, they're going to have a lot of symptoms. The gas, the bloating, the unwanted symptoms that can come with increasing fiber way too quickly. So I know I didn't talk too much about acid reflux, but I do want to mention it because I know there's a question on the test, and I know that your clients probably struggle with acid reflux a little bit. So just to give you a couple quick things for acid reflux. One is the breathing before meals can really help. If your client is sitting down stressed to eat, that's going to make their acid reflux worse. Aloe vera after meals, 1 teaspoon can be super helpful. The digestive bitters can be very helpful as well. Focusing on the meal hygiene piece, as I mentioned earlier, and then Saccharomyces cerevisiae, that strain of probiotic, is extremely helpful for acid reflux and suppressing that symptom that they might have. So let's talk about some obstacles and challenges that you might have. One is probably the number one is food mindset about food and what it's going to do to their body or what it may or may not induce symptom-wise, and then how that affects the nervous system and how that affects digestion. You will see that your client is continuing to be in a sympathetic or stressed state and having digestive symptoms if their mindset about food is constantly negative. So we really have to work on that piece and getting the body to see food as a safe thing, or at least creating safety around the meal experience. So decreasing stress when they're sitting down to eat can make a huge difference. And over time, this can continue to improve. Because what we don't want is every time your client sits down to eat, they feel like there's a bear at the table and they're going to get attacked. That's what your client's nervous system is doing. And how is that affecting their digestion? Everything's turning off, which then is affecting everything that I talked about earlier. So we have to work on this stress state with some of the tools that I mentioned in order to improve the gut, so that they can incorporate variety, so that they can eat a wide variety of nourishing foods that they love, that they enjoy, that bring them pleasure, and so that their gut can flourish and thrive. And you may feel like your client is so far away from this, but I'm telling you, these little interventions can really help. Those small amounts of little diversity that you can add as far as fibers and plants will help to promote this diversity. The more that you can get your client out of a stressed system, the more their digestion will thrive. And then in the next couple sessions that we have, we're going to talk about specific probiotics, prebiotics, supplements, etc., that you can use to help promote digestive health. So the motto here, like I mentioned, is slow variety, low and slow. You don't want to increase diversity super quickly, but you do want to slowly add these things in. All right, so just some takeaways. If the client is constipated, we are going to get the bowels moving first. We can use magnesium, we can use ginger tea, we can use vagus nerve stimulation, we can use hydration. There's lots of tools there that we can use. If the client has gas or bloating, we're going to rule out constipation first, and then we can use the tools like the digestive bitters to help promote optimal digestion and decrease the symptoms of bloating and gas that they are having. If the client has diarrhea, we're first going to rule out constipation, and if it's not constipation, we are going to reduce the stress response And the other caveat here that I would add is you're going to want to really focus on increasing that soluble fiber to help bind the stool back together. So when you transform the gut, you can definitely transform the client outcome. Slowly but surely, you can do this, and your client will not have to experience these uncomfortable symptoms. Obviously, this can be greatly oversimplified. I know that it's not as easy as 1, 2, 3, but implementing some of these tools can definitely help. So I have this digestive checklist. I know I've given this on other webinars before, and I'd love to give it to you. There's actually other stuff on this checklist that we didn't talk about today. So if you want the checklist, there's just a quick feedback form, and then it will be emailed directly to you. So if you don't want it, no problem. But if you want it, go to this website and you can download it and save it. It's just a Google Doc. You can make a copy of it. You can go through all the check marks with your clients just to help you kind of remember the process here. And here's how we can connect. I'd love to hear from you. I'm probably on Instagram the most. If you want to send me a message, ask any questions. I'm an open book. I will always answer questions and love to chat. So with that being said, any questions that anyone has? If Tamara, I guess you want to kind of take control of that. And then, like I mentioned, the references are here. So thanks so much for being here.
Thank you, Heather. We have, as you can imagine, a ton of questions, and we'll try to get to some of them. But before we do that, just a really quick reminder, 2 reminders. Folks, I know lots of the folks that are on are clinicians and might have to hop off at the top of the hour. So if in case we go over that a little bit, I just want to make sure that everybody remembers these 2 things. First of all, when we end the webinar, an evaluation will pop up on your screen. If you'd be so kind as to take about 30 seconds to complete that evaluation, that would be really helpful for us. That's a continuing education requirement for Center for Change. It's completely anonymous, so feel free to be candid in your feedback. Once we get all of the feedback, we tabulate those results, send those to the CE approval entities. And then about an hour after the webinar ends, you will receive a separate email from GoToWebinar. It will look similar to the email you got, the confirmation email you got when you signed up. It's a separate email from GoToWebinar with a link to take the online test. That link takes you to ClassMarker. And then when you complete the test and pass it, your CE certificate will automatically be downloaded to your computer. So if you don't see it on your screen, check your downloads file because it might be there. Okay. First of all, we had lots of requests for lists of the foods that you mentioned, or supplements, or those kinds of things. I think I would just first of all point folks to the website that you gave, or your website at the end of the last slide, just before the reference slide. They can get lots of that information there. The other thing I would say is if you go to Heather's Instagram, there's a ton of information there. She provides a ton of content about specific foods and beverages and supplements, etc. So I think that might be a good place to start for those. Okay.
And also, just to add, Tamara, really quick, the next presentation in the series in August is going to be all about nutrition and supplements. So we'll talk way more in depth about specific foods, supplements, all that on that one too.
Perfect. That's August 24th at the same time at noon Mountain Time. So keep an eye out for, you'll see emails come out about that in the next week or so, and you all can sign up for that if that would be helpful. So thanks for that reminder, Heather. That's right. I forgot we were doing that next. Okay, so I'm going to try and then pick ones that are not going to be addressed next time. So okay, this is a great question from Kelly. Kelly says, does breathing before a meal provide a similar effect as gargling and humming?
Yes, so breathing, especially if you do like conscious breathing, you're going to decrease the stress response. You're going to get into a parasympathetic state. What gargling is doing is it's aggravating the vagus nerve, which is then promoting a parasympathetic state in the body. So yes, you can definitely achieve that. There are obviously different mechanisms in some sense, but like one breathing exercise that we have our clients do is called 4-7-8 breathing. So we have them breathe in for 4, they hold for 7, and then they breathe out for 8. That can just decrease the stress response. We have them do that like 2 or 3 times, and it's going to help get in a rest and digest state where stomach acid, digestive enzymes, everything else is working a lot better.
Thank you. Next question. This is from Albert. Albert asks, how does alcohol affect the gut with clients with eating disorders? That's probably a whole webinar in and of itself, but I'll let you just tackle that.
So in general, like, I don't know that there's specifically been any studies I can look on alcohol, the gut, and eating disorders, but from what I know about research, alcohol in general is going to decrease stomach acid, which, very simply put, your stomach has to fill with acid to then empty. So those clients that you have that have delayed gastric emptying, there's probably a stomach acid component there. So alcohol is going to decrease stomach acid. Alcohol actually is going to increase estrogen, which that's like a whole nother topic for another time. And then it does damage the gut lining. So that leaky gut, intestinal permeability concept I was talking about earlier, the alcohol, especially in excess amounts, is going to damage the gut lining. So like specific to eating disorders, I feel like it's probably just adding fuel to the fire that's already going on, but I don't know that there's any specific studies.
Thank you. Valerie asks, is fresh juiced ginger recommended?
Yeah, you could definitely do fresh juiced ginger. It's going to be pretty strong. One thing that I didn't mention about ginger is if your client has acid reflux, you probably don't want to recommend ginger. Ginger is a very warming herb. Just naturally, it's going to warm things up. And it can definitely contribute to more like reflux symptoms in someone that's already experiencing it, especially if they drink it and then lay flat. So you definitely don't want them to drink it like right before bed or something, give an hour or so. But yeah, I would just play with the amount that you use because it's going to be pretty potent.
Holly asks, what are your recommendations to follow your gut instinct that the client may have SIBO?
Yeah. So some common things that you would want to look at would be what I was talking about earlier, the like common not normal symptoms. So chronically bloated by the end of the day, where their like stomach is super distended, hard, feeling 9 months pregnant, having a bowel movement every 7 days, or just like chronic diarrhea that won't stop. But I guess the caveat here too is that SIBO is a sign of a greater issue. So yes, if your client has SIBO, you're going to want to address it. But at the end of the day, SIBO is a dysbiosis issue as well. So you want to figure out also what's going on in the large intestine and address that too, as well as like with gut motility. So that being said, chronic, really painful bloating, really infrequent or too frequent bowel movements, nausea, and then like nutrient deficiencies. So like chronically low iron, chronically low B12 would also indicate maybe SIBO.
I think this is probably the last question that we have time for today. What do you think about, excuse me, what do you think about the effects of low FODMAP on the gut biodiversity?
Yeah, this is a great question. So low FODMAP is meant to be a short-term elimination. I think low FODMAP has become a lifestyle for so many people. They're like, even if you look on Instagram, there's hashtags like low FODMAP living. I'm like, no one is supposed to be living low FODMAP. That's not how it's supposed to be. But low FODMAP is basically supposed to be you eliminate the FODMAPs and you reintroduce them after 4, 6, 8 weeks to determine which FODMAP category you are reacting to. And then, it depends on which camp you're in, which there's lots of camps. Some people will say just don't eat that FODMAP category because that's the trigger. But my personal opinion is if you can fix the underlying dysbiosis issue, the reason that someone can't tolerate FODMAPs, which most FODMAPs are prebiotic fibers, the reason someone can't tolerate those is because of the lack of diversity of gut bacteria. As humans, we can't digest fiber. Our gut bacteria digest fiber for us. So when we have a decrease in the amount of bacteria, in our gut, no wonder you're having bloating, constipation, whatever it might be, as a result of eating FODMAPs. And then I guess the other last thing I'll mention, I know this is kind of a long-winded answer,
You're
but the
doing
last
great.
thing
That's
I'll
all right.
mention is FODMAPs actually draw water to the bowels. So specifically for someone that has constipation, I definitely would say low FODMAP is probably not the way to go if they're already super restricted. And there's very few instances where I think low FODMAP would ever be recommended, especially for someone with an eating disorder. So I hope that wasn't too long-winded, but that
It was great. It was thorough, and I appreciate it. Thank you. My thanks again to Dr. Heather Finley for being with us today. We hope you all can join us again next month. As Dr. Finley said, she'll be talking specifically about supplements and interventions, and that's going to be wonderful. So August 24th for that. I'll go ahead and end the webinar. You'll see the evaluation pop up, and then an email about an hour from now with the link to take the test. Thanks again. Take care, everybody. We'll see you next time.
Thanks, Tamara.
Bye.